Hello friends, today let's talk about the topic factors causing sport injuries and complication of incomplete treatment. A physically active lifestyle is important for all age groups. Reasons to participate in sports and physical activities are many, such as pleasure, relaxation, competition, socialization, maintenance and improvement of fitness and health. The regular physical activity reduces the risk of premature mortality in general and of coronary heart diseases, hypertension, colon cancer, obesity and diabetic mellitus in particular. However, sports participation can carry a risk for injuries, which may in some cases lead to permanent disability. People who participate in sports are more likely than others of the same age to have muscle and tendon injuries and bone fractures. This certainly does not mean we should avoid sports. The health benefit far outweighing the cost in terms of sport injuries. So here comes the causes of sport injuries. Sport injuries are most commonly caused by poor training methods, structural abnormalities, weakness in muscle tendons, ligaments, and unsafe exercising environment. The most common causes of injury is poor training. For example, muscles needs 48 hours to recover after a workout. Increasing exercise intensity too quickly and not stopping when pain develops while exercising also cause injury. So here comes the factors causing sport injuries. A multitude of situations can result in sport-related injury. Being aware of the risk factor goes a long way in preventing them. Strengthening muscles, getting proper rest, and working at the proper rest are essential in staying healthy. A look at the causes of the most common sport injuries paints a clear picture of the main culprit behind them. So here comes the overuse. Overuse or repetitive movements may be the number one causes of sport injuries. Runners, swimmers, and tennis players are particularly susceptible to overuse injuries, including tennis elbow, tendinitis, shin splint, and shoulder impingement. So here comes the falls. Any athletes can fall in the midst of the activity. In addition to the obvious breaks that can occur from a fall, wrist sprains are common. Our natural instinct when falling is to put our hands down to break our falls. Our wrists bear weight which can easily stretch or tear a ligament. Next one, new or increased activity. Starting a new activity or increasing level of activity too quickly can also result in plantar fasciitis or lower back pain. If new exercise or sports has begun, previously unused muscles may be employed or it may increase the work of other muscles. A cramp is a common result of this. Next one is fatigue. The tired muscles are a common cause of muscle pull. Resting between activities is essential to preventing muscle pull. The next one, poor warm-up. The warming up delivers blood and oxygen to the various muscles, allowing them to work more efficiently. Muscle pulls and cramp are often the result of jumping into an activity without properly easing the muscle into it. The next one is impact. Hard impact are another culprit behind injuries such as shin splint and plantar fasciitis. Hard surfaces cause a more jarring impact on an athlete's feet, leg, hip and back. The next one is unilateral movements. Lower back pain plagues some golfers and tennis players, among others, because these activities required certain movement by only one side of the body. Muscles are working on one side without doing equal work on the others. This can result in weaker muscles on the less activity side, the most common cause of the lower back pain. The next one is techniques or posture. Neck pain, including spasms and pulls, is often the result of something as simple as moving our head awkwardly to see a ball or an opponent. Cyclists may experience neck pain after riding with racing handlebars. Here comes the measures to reduce the risk of sport injury. First one, plan to have at least one day off per week and at least 1 month off per year from training for a particular sport to allow the body to recover. Second one, wear the right gear. Players should wear appropriate and properly fit protective equipment such as pads for neck, shoulder, elbow, chest, knee and shin. Young athletes should not assume that protective gear will prevent all injuries while performing more dangerous or risky activities. The third one, strengthening muscles. The conditioning exercises during practice strengthen muscles used in play. The fourth one, increase flexibility. Stretching exercises after games or practice can increase flexibility. Stretching should also be incorporated into a daily fitness plan. The next one, use the proper techniques. This should be reinforced during the playing session. Take breaks. Rest periods during practice and games can reduce injuries and prevent heat illness. Play safe. Strict rules against head-first sliding in the baseball and softball and spearing in the football and checking in hockey should be enforced. The last one is stop the activity if there is pain. So here comes the complication of incomplete treatment of sport injuries. So here comes the stress fractures. Stress fractures are the common sport injuries. They are break in the bones but can be thought of as an cracks, sometimes full thickness cracks, rather than complete break in which the two parts of the bone separates. Stress fractures are overuse injuries. They can occur when muscles are fatigued, weakened or injured and cannot absorb added shocks. Eventually, the overload of the force is transferred to the bones where it causes tiny cracks. The second one, foot and heel pain. This often arises from the tendons in the foot and heels, which may be strained by overuse or by sudden twisting and imbalance. One common condition is plantar fasciitis. The plantar fascia is a thick band of tissue stretching under the foot. The third one is ankle pain. The Achilles tendon is a strong tendon which connects the muscles of the calf to the heel. It is a common source of pain in the back of the heel and the ankle, leading to Achilles tendinopathy or Achilles tendonitis. The Achilles tendon is also the most commonly ruptured tendon. It can occur partially or completely. The Achilles tendon rupture is usually caused by overstretching of the tendon. The fourth one is lower leg pain. This is most commonly due to muscle strain or cramps. These are often caused by a combination of heat, lack of fluids in the body, that is the dehydration, and inadequate warming. The second one, shin splint. This is a term for pain in the shin bones relating to exercise. It occurs when the edge of the shin bone becomes inflamed due to muscles and tendon pulling on it during exercise. This often happens after running or jumping or sports with sudden stops and starts such as basketball or football. Sudden increase in running distance or pace can also trigger it. Shin splints can sometimes form mini-stress fracture, that is, surface crack in the bones. This may occur after landing with particular force and can be extremely painful. The next one is knee and thigh pain. The injuries to the knee and thigh are particularly common in sport such as football, which involves running and twisting. This can strain the strong support ligaments inside the knee, leading to knee cartilage injuries and knee ligament injuries. So here comes the anterior knee pain. Anterior knee pain means pain in the front of the knee. It is common in teenagers and young sporty adults. It is often called patellofemoral pain syndrome and is often an overuse injury. It can relate to abnormalities in the run caused by a poor lineup of the legs when running. Osgood scattered disease is another cause of knee pain in young people, that is, in the adolescent. The condition is aggravated by exercise. It causes a swelling and tenderness of the tibia tubercles, which is the bulge of the bone at the front below the knee. So here comes the lateral and middle knee pain. Lateral knee pain means pain on the outer side of the knee. Medial knee pain means pain on the inner side of the knee. Common causes include iliotibial band syndrome. The iliotibial band syndrome is inflammation of the iliotibial band occurs on the outside of the knee only. These tight bands of muscles and tendons on the outside of the knee can rub against the outside of the knee joint. It is an obvious injury which is difficult to treat without physiotherapy advice. Hamstring injury can be a persistent chronic injury. It usually involves the part of the hamstring called the bicep femoris and is brought on by running downhills, kicking and sprinting. It is also possible to tear the hamstring suddenly. Depending on how big the tear is, this can be very sore, causing bruises and stop one from playing for several weeks. The next one is bottom, that is buttock and hip pain. Pain in the bottom in runners may come from joints, ligaments, tendons and a large gluteal muscles. It is also possibly for a runner to develop small cracks, that is stress fracture in the thigh bones, although this is uncommon. The injuries can be chronic or sudden, and they are common in sports involving running, twisting and kicking. So here comes the lower back pain. Pain in the lower back is often due to underlying back problems which are made worse by sports. However, strain on the lower back is severe in those lifting weights, particularly if the technique is not excellent. The lumbar instability occurs when part of the lower back has too much movement. Lower back pain is very common in distance runners who lack core strength in the muscles around the trunk which support the back. The core strengthening exercise to support the back can be helpful. And the next one is the tummy or abdominal pain. The abdominal pain in sports may be due to muscular strain. Vigorous exercise may lead to pain due to stitch. Stitch is a word for pain from muscles when breathed with, that is the diaphragm, particularly if we are not warm up. So here comes the chest pain. Chest pain when exercising is often muscular due to the muscles of the chest walls working hard when breathing hard. In some sports such as weightlifting and rowing, pain is due to those muscles working hard due to lifting or pulling. And next one is upper back and neck pain. Pain in the neck and upper back are most commonly muscular and due to poor posture. And next one is shoulder pain. The most common causes of shoulder pain in sports are swelling, that is inflammation, and pulls and tear to the muscles around the shoulder. The rotator cuff muscles are 4 muscles important in rotating and lifting the arm. They are prone to injuries when falling or during a sudden powerful movement such as throwing or paddling a kayak. The shoulder dislocation can occur in contact sports and swimming. It causes severe shoulder pain. A broken collarbones or a sprain to the joint between the collarbones and the shoulder can occur if we fall onto a shoulder or an outstretched arm. The injuries, strain and tear to the biceps and triceps muscles can occur in those who use their arm in sports. The next one is elbow pain. Pain on the outside of the elbow, that is lateral elbow pain, is commonly due to tennis elbow. It is an obvious injury. It is typically seen in sports like tennis, involving repeated bending back of the wrist against resistance. Weight training can also be a cause. Pain on the inside on the elbow, that is middle elbow pain, is commonly due to golfer's elbow. This is typically caused by repeated bending the wrist inwards against force, such as when using a golf club. The last one is wrist and hand pain. Sudden wrist injuries may be fracture or sprain, or overuse injuries such as wrist tendinitis and carpal tunnel syndrome. So here comes the conclusion of today's topic. The sport injuries are an unfortunate and prevalent side effects of engaging in athletes' competition. If not treated properly, injuries suffered while playing a sport could not only hinder our ability to compete but could also have devastating long and short-term effect on the body. Small, seemingly insignificant injuries could snowball into injuries that could end one's athlete's career early. Many sports have injuries and are very specific to the sports or occur in only a few sports. Younger athletes should be educated and protected from the degradation of specific body areas due to threats of sport injuries.